Hi everyone, it's Andy the physio from Active Therapy. So today we're going to run through something called the posterior pelvic tilt. So a lot of the time people have heard of the anterior pelvic tilt, which is pretty much when you're standing with that posture of like the hyperextended lower back posture, which is, it's not a bad thing unless you are getting discomfort and pain from it. But today we're going to teach you how to get out of it, and it's going to feel quite unnatural for some of you. So the reason we do engage in a posterior pelvic tilt, or the reason we want you to do that, is to get you out of that same position, especially if it's been irritating that lower back region. So essentially, if you're unable to get out of that position of the anterior pelvic tilt, then you are constantly using the same tissues, same joints, same structures again and again, 24 hours a day, which can lead to some sort of irritation around there, especially if you have no control of getting out of it. So that's what we're doing today, teaching you how to get out of that sustained position so that you can get some relief. Or if you want to just up your core game, then this is another thing for you to consider. Let's get to it. Alright, pop quiz. Who knows what this is? The pelvis. Good job. So what we're looking at to posteriorly tilt the pelvis, essentially the motion is that, alright? That. Because this is the front, this is the back where the tailbone is. That's the tailbone. So we want to tilt it back like that. Alright? So to do that, one thing we need to do first is sort of identify what is the pelvis on you and which part of the pelvis needs to move. Alright? So what we're going to do is we're going to feel for this bony ridge up here first. We'll get to this in a second. The bony ridge up here. So to do that, what you need to do is, very simply, put your hands on your waist like a teapot. I'm a little teapot. Put the waist there. You should put the bony ridge just underneath the love handles if you're lucky enough to have them. All right. So just there. And what you need to do is move your fingers forward along that ridge until you feel a really pokey kind of sharp bone right in the front there. That is what that red point is for. You're going to be feeling that bony ridge like a teapot all the way to the front until you feel this sharp point here, and that's where I want you to pay attention to. What we're going to do here is, I'm showing you a side-on view, and I'm going to show you a bit of skin. So I'm going to show it a bit easier. With this, hand on the waist, pointy bone here. Right now you can see that, you can feel that sort of pointing forward, right? Pointing forward, neutral. Unless you are actually pelvic tilted, but that's a different story. Right now, assume it's pointing forward. What I want you to do is to imagine it pointing up. So, towards your head, tilting it like that. So the red point, the sharp bit, is pointing towards your head. So I'll show you what that looks like. From here, pointing forward, I'm going to point it up. Up. So if I show you, pointing up. Up. That's what it should look like. And what you should feel here is the muscle underneath the belly button sort of engage to pull it up. You might feel the butt work a bit as well, but mostly in the front here. So you should be feeling it here, not so much the upper core here. If you're doing that, that probably means that you're really exaggerating it, so you're like, ugh. So really overdoing it with the rib cage as well, which is not what we want. We just want to tilt the pelvis, not go for a full crunch. Yeah? So feeling that mostly here, tilt it towards the head. And what you should feel if you're very tight in the lower back is that you might feel this sort of stretch out a bit as well. Okay? So, of course that's going to need a lot of practice, especially if it's your first time doing it. But essentially, again, it is sort of that point, tilt it towards the head. Towards the head. And towards the head. Alright? So, good job. You've done your first posterior pelvic tilt. So completing the posterior pelvic tilt can be quite unnatural at first, but it's because you haven't done it before. So if you're one of the lucky ones who have gotten it on their first try or within the first 5 minutes, congrats. A lot of the time people take a few sessions, 1, 2, even 3 or 4 to sort of get it, because it is such a weird movement for some people. So keep practicing, do as many reps a day as you can to get that sort of engraved into it. But if you're feeling any kind of pain or discomfort with it, or you're just not getting it, then give us a call or contact us on the Active Therapy website to sort of get you better at this before we progress you a bit more. Alright? If you have any questions, comment below or send us an email. Otherwise, stay safe, stay active.